Group leaders need to be receptive to self-examination and to questioning the professionalism of their group practice if they hope to become competent, ethical group practitioners. In addition to learning about ethical decision-making, there are 3 other experiences counselors need to train in as effective group facilitators. The first one is self-exploration and experiential groups. Group leaders need to demonstrate the willingness to do for themselves what they expect members in their groups to do. So expand their awareness of self and the effect of that self on others is crucial. Participating in a therapeutic group is very valuable. One of the best ways to learn how to assist group members in their struggles is to be a member of a group yourself. Have safeguards in place to manage boundaries and reduce the risk of harm. Supervision is critical for new facilitators to monitor any interns or students who exhibit any type of problematic behavior. The second one is personal psychotherapy. Sometimes issues that surface in a group experience are more appropriately explored in personal therapy. Therapy also enables us to understand both ourselves and others, which is essential for ethical practice. It enables us to identify and explore countertransference reactions. Explore countertransference reactions we may have towards certain group members. Recognize our blind spots and biases, and use our personal attributes effectively in our work as a group facilitator. Lastly, we have group supervision. Supervision is a key component in training group leaders. Good supervision can offer trainees many opportunities to learn about the process and development of a group. Students should ask themselves, what steps can you take to acquire competence as a group facilitator? Can you think of ways to minimize the potential risks of combining experiential and didactic methods? Does ethical practice demand that group leaders receive some personal therapy? An important part of training group leaders is promoting sensitivity and competence in addressing diversity in all forms of group work. To fail to address diversity issues that arise in a group is to fail the group members. The text introduces the idea of integrating social justice into your group practice. Social justice is the fair and equitable distribution of power, resources, and obligations in society to all people, regardless of race, gender, ability, status, sexual orientation, and religious or spiritual background. The text recommends that some strategies for infusing social justice into group work include values clarification, helping your group members understand what their values are, empowerment of gender and ethnicity statuses, consciousness raising, self-disclosure, social and gender role analysis, structure to maximize group cohesion. To review some ethical guidelines for acquiring diversity competence in group practice, look in your chapter on page 438 and 439. It'll give you some great examples for that. Each group member should be presented with information about group treatment with an informed consent. This should include information such as topics pertaining to the nature of the group, therapist qualifications, techniques often used in the group, the rights and obligations of group members, and the risks and benefits of participating in the group. To review more about informed consent, go back to chapter 5 where we really talked about that, and it's explained quite thoroughly in that chapter. Group leaders are faced with the difficult task of determining who should be a group member and who should not. Often it's easier to determine who should be excluded from group than who should be included in the group. Your ACA 2014 Code of Ethics does address this issue. Counselors screen prospective group counseling therapy participants. To the extent possible, counselors select members whose needs and goals are compatible with the goals of the group, who will not impede the group process, and whose well-being will not be jeopardized by the group experience. Any of us that have had some experience working in groups can understand that not having appropriate group members can absolutely sabotage the entire group experience for everybody. Your text gives you some examples of maybe poor candidates for group. Brain damaged people, acutely paranoid individuals, antisocial personalities, and it also mentioned people who are actively using drugs and alcohol. Now, research in the field of addictions indicates that groups are very effective with these clients, unless they're under the influence or detoxing. Then they're probably not appropriate to be in the group at that time. Counselors should meet with clients prior to attending group, and the reason for that is to respond to any questions or concerns they have. Any of you that have never participated in a group knows how frightening it is to think about even going into a group with other people there. So answering any concerns or questions they have may help eliminate some of that anxiety. Explain the group process. Clarify on how members are expected to behave. Things such as being there on time, not interrupting, no anger or threats, things like that. Explain expectations on what the group can accomplish. Clarify the goals and objectives. Explore the risks and values of group participation. Values and limitations of groups. Psychological risks and ways of minimizing these risks. Explore fears and resistance. We know that sometimes participation in group is not always voluntary. So, obviously, voluntary participation is an important beginning point for a successful group experience. However, when group attendance is mandatory, group leaders must be certain that they understand their rights and responsibilities. So, the nature and goals of the group should be discussed. Your members have the right to decline certain activities. They need to understand the limits of confidentiality. The effect of their participation in the group will have on critical decisions about them outside the group. Procedures for leaving a group should be explained to all members during the initial session. In other words, you really do need to set up some group rules. Clients have a responsibility to the leader and to other members to explain why they want to leave. Maybe it was due to some feedback they received that was a misunderstanding. It's important to the group to know what the person found uncomfortable or threatening about the group. So what this is really saying is it's really critical that the client understands that if they don't want to be a member of that group anymore, they really do have a responsibility to let the group understand why they don't want to be there anymore, why they're leaving. The feedback could be very valuable. Group leaders have an ethical responsibility to take precautionary measures to reduce unnecessary psychological risks. Some potential risks include disruption of the client's lives as a result of the group work. They have to be somewhere now every week or twice a week for a couple of hours. Their privacy may be invaded. Clients are encouraged to be completely honest. Group pressure. should never have to talk about an issue they don't want to, and should not be coerced into doing an exercise they don't want to. Scapegoating. That's unchallenged projection and blaming, and that can occur in the group. Misused confrontation. That would be things like harmful attacks under the guise of sharing. We should never permit this. You as the group facilitator have an ethical responsibility to make sure that everybody in the group is safe. There is no guarantee of confidentiality, but most of us will take the time to set up a group rule, encouraging that whatever is said here stays here. A clear grasp of boundaries is critical. Working with an experienced co-facilitator is a way of learning good group skills and ways to reduce potential harm. So some of the things we just talked about as far as the risks go are also things that you really need to look at and share with your client in informed consent. If you look at the scapegoating and the misuse confrontation, again, that's your responsibility as a facilitator not to let that go on in the group that you are in charge of. As previously mentioned, setting up group rules and contracts are helpful. When I'm doing a group, whenever we get a new group member in, I take that opportunity to allow the group to go over the group rules. Doesn't just reiterate it to them, but they're also teaching the new group member what some of those rules are. Group leaders do have the ultimate responsibility of protecting the clients in the group and not allowing harm. We need to teach our members about breaking confidentiality. We need to teach them about the legal concept of privileged communication. But we have to help them understand that privileged communication generally does not apply in group settings. So it is our responsibility of helping our clients to understand what the limits of confidentiality are, their responsibility to other group members, the absence of legal privilege concerning what is shared in group. But just like in individual sessions, in order to do some good group work, you have to be able to trust each other in the group setting. Teach members about breaking confidentiality. It's so important to entrust group and cohesion. Because of the limits, make an informed consent about what is shared in group. There are some exceptions to confidentiality, and we've already talked about some of them, but your group needs to know that also. Some of those include if members pose danger to themselves or others. Other issues discussed in Chapter 6 also apply to group work. It's important to give members a written statement about the nature, purposes, and limitations of confidentiality, when it will be breached, and what will be documented. Become familiar with state laws. Also, be aware of confidentiality with minors. Know what the state laws are pertaining to minors. When can a minor seek help without parental consent? Be able to define an emancipated minor. Know the rights of parents to have access to records of the minor. It's a good idea to get written permission from parents before a minor enters any kind of treatment or therapy. Try to work cooperatively with parents on what they need to know. Be sure to use a vocabulary with adolescents that they can understand when explaining groups and informed consent. The book takes the position that group work cannot be ethically conducted over the internet.